Well, here we are. You can tell it's winter. Behind me is a miniature plum tree. Not the tree's miniature, but the actual plums are miniature. And if we come back here in about 4 to 6 weeks, it'll all be full of flowers and possible greenery. So in nature there is a balance, as we all know, and it's the same with humans. Now, what I'd like to look at today is healthcare, because although COVID-19 has highlighted the inadequacies in the private and public healthcare system, we still had issues, major issues before COVID-19, and we'll continue to have more issues. So if we look at the way the healthcare sector is structured in Australia, both the federal government and the state governments, the territory governments, have responsibility for the provision of healthcare. The Whitlam Labor government in 1973 introduced what they described then as Medibank, which is now called Medicare, which was a universal system which allowed everybody in this country, permanent residents and citizens, to access both public and private healthcare. That's the first thing. So there are different funding models by both the federal government and the state government in terms of providing healthcare services. Not just acute medicine, but chronic medicine, long-term medicines, issues like the pharmaceutical benefit scheme, the national disability insurance schemes. These are all schemes which have been introduced and expanded in the last 4 decades to provide access to healthcare. Now, we have a number of specific problems related to the provision of healthcare in this private-public mixture. The first problem is the amount of resources that the government has allocated to Medicare, that's the Commonwealth government, continue to decrease and don't reflect the cost of providing private healthcare. And then we have a system where the so-called specialist or a specialist is highly rewarded under the universal healthcare system, under Medicare, compared to a general practitioner who basically does most of the work. So that's one problem. So the amount of money which the Commonwealth government has allocated for Medicare per head of population, per consultation, continues to decrease dramatically, forcing many private health providers to abandon Medicare. The system is acute in the private hospital system, where irrespective of whether you're covered by Medicare, private health insurance, the fact is that the out-of-gap costs are increasing rapidly. At the same time, we have a public health system which is designed and expected to deal with the more urgent and pressing issues in society, and a private health system which cherry picks the more profitable surgical cases and provides very little acute emergency care. So if you are seriously injured in some type of accident, you will invariably find yourself in the public health sector. Now, apart from the fact there is a chronic lack of funding for both social and preventative medicine, as we've seen through COVID-19, and through the provision of acute care, and through the provision of chronic long-term care, apart from the funding issues, there's issues about staff, there's issues about privatisation of large segments of the public health sector across the country, and there's issues regarding changing demographics. Because in many ways we have become victims of our own success as far as healthcare is concerned. As life expectancy increases, what we find is that the number of comorbidities, the number of associated health problems which each individual faces increases. Because as a flesh, blood and bones organism, there is use by date regarding us as human beings. And as we grow older, except in a very small limited number of cases, the amount of medications that are required, the amount of healthcare that is required, the amount of access to medical practitioners and paramedical staff is required increases dramatically. So as the population ages, we find the demands on the healthcare system increase. So that's one of the major issues we currently face. At the same time, we have many health issues in this country which are directly related to the type of society we live in. For too long we have considered healthcare to be an individual responsibility. Although we accept that many cancers happen, we don't accept that much of the mental disorder, and 2 out of 5 Australians will at some stage during their life have an acute psychiatric crisis. That much of this is what you call a reactive anxiety, a reactive depression illness, which is directly related to the type of society we've created, a society based on profit, irrespective of the human, social, environmental and personal costs. So we've got this combination of an increasingly rapidly ageing population and a younger population that finds itself under increasing pressures. Pressures like climate emergency, work insecurity, inability to access secure accommodation, and the resulting psychological and psychiatric issues which are directly related to that. Now, these are issues which are diametrically opposed to endogenous psychiatric disorders like schizophrenia, endogenous depression, and the major psychiatric disorders. Although in terms of outcomes, whether it's a reactive depressive illness or endogenous depressive illness, the suicide rates are reasonably the same. So we've got a younger population which is under increasing stress for a variety of reasons, many of them which are structural. And we've got an older population who has its ageing, it finds itself needing to access healthcare. And the only major positive over the last 50 years is the decrease in Western society in infant mortality. We don't have illnesses, we don't have 50% of children dying before the age of 5. And the most common causes of childhood deaths are injuries and childhood cancers. And most of the infective diseases which cause such issues in the 19th and half of the 20th century have now been brought under control with vaccination. Although we do see that as people, for various reasons, are refusing to vaccinate children, that we are seeing the return of mortality related to the lack of vaccination, as we saw in Samoa with the measles epidemic, and as we recently saw in the north coast of New South Wales with 2 cases of whooping cough. So there have been major advances, and even if you sustain a diagnosis of carcinoma or cancer, which would have been a death sentence 50 years ago, you find a significant number of people increasingly surviving with modern treatments. The other dilemma that we face is the wholesale privatisation of the Commonwealth Serum Laboratory in the 1990s, so we didn't actually have a vaccine research or vaccine production mechanism. And more importantly, we've seen the privatisation of the pharmaceutical industry. And many of the increasing costs related to healthcare in a public health sector are related to the pharmaceutical industry, the private pharmaceutical industry being the only sector of society that is researching and producing pharmaceuticals at extraordinary cost, because they can actually claim that they've invented that particular treatment, although no treatment is invented by itself. It is part and parcel of a long list of production of knowledge, but they can say that they have done that, and that gives them 25 years where they have the sole right to produce that medication for an extraordinary profits. And that's why some of the largest pharmaceutical corporations on the planet now have such a hold on us. So they're increasing costs, and I'll go through them again. An ageing population, staff shortages because we've refused to train people and relied to a significant degree on importing fully trained people to provide care. The privatisation of the pharmaceutical industry and the vaccine production industry, which gives the private sector extraordinary amount of power in terms of setting prices. The divisions between the federal government and the state governments in terms of funding, and the lack of funding, especially in the smaller states like Tasmania and South Australia, where we see the problems are more acute because of the lack of a base. And we see an inability and unwillingness by parliaments at both the state and federal level to tax corporations and individuals who are making extraordinary profits in 2022. So we've got all these issues that face us. So the daily horror stories of people not being able to be picked up by an ambulance, by people dying while they're waiting for an ambulance to arrive, of ambulances being ramped up outside accident emergency departments for 5, 6, 8 hours, taking an ambulance and 2 paramedics out of circulation for that period of time. The problem of elective surgical admissions being cancelled ad nauseum, pre and post COVID-19, the increasing stress on the health sector by COVID-19 and the government's inactions, especially the previous coalition governments, in tackling this particular issue. The lack of publicly owned pharmaceutical companies in this country and research facilities publicly owned, and the increase in insecurity. So we have all these issues. Now, we can fund an adequate health sector by increasing resources for training in universities across this country, by providing free education for citizens and permanent residents, in particular healthcare fields, especially those where there's a shortage. So we can improve training, but it actually means more resources. We can actually improve the number of staff, the type of care provided, the return to general practitioners through the Medicare. But major changes need to be made regarding funding. Now, the Medicare levy only accounts for about 20% of the federal government contribution. So what we need to be looking at is new taxes. I know everybody's running the other way and talks about less taxation, but you see, it's simple. It's like a budget. The less that comes in, the harder your life becomes. You get to the stage where you can't even pay the rent and buy adequate food supplies. It's the same with the healthcare sector. The less the resources, the less an overworked healthcare staff services they can provide. It's very simple. So what are ways? Well, obviously, possibly a super profits tax at the federal level of 10% on corporations with a turnover of more than $50 million per year would be able to increase the government's resources in terms of providing healthcare. At the state level, there's various types of taxes you can introduce. A 1% super land tax, a 1% super land tax for, say, property owners who have more than $5 million in property. You can put in a financial transaction tax at the federal level of 1%, which would raise over $120 million. You can introduce a 1% stock market turnover tax, which would raise at least $35 to $40 billion per year. So by just tinkering with the taxation system, you can raise over $250 billion per year, which would ensure that we would have a healthcare system which could deal with the healthcare problems we will face as the future becomes more and more difficult because of the climate emergency, because of increased anxiety and mental health issues, because of increasing insecurity in society, because of an ageing population, because of increasing frequency of epidemics and pandemics, because of the climate emergency and major temperature changes in the world. But if we are not willing as a society to raise these issues publicly about ensuring that the 1% that own the means of production, distribution, exchange and communication pay their fair share of tax, and ensuring the 8% of Australians who take advantage of this country's investment-friendly laws like franking, stock market franking credits, negative gearing, actually pay their fair share of tax, we will continue to pay the price that we are paying today. Staff shortages, increasing waiting lists, inadequate ambulance services, overcrowded accident emergency departments, a private health system which is beginning to abandon Medicare and putting healthcare out of the reach of many Australians, especially Australians who earn less than $1,500 a week. Because to a significant degree, Australians who are on social security benefits do get access to public health and privately have access to general practitioners who bulk bill, because there is an incentive to see people on social security benefits and children under 16. But people on low incomes are those that are now suffering the most, who are foregoing dental care, who are foregoing access to general practitioners, who are delaying diagnosis, who find themselves in this particular difficult situation. Now, this is not something that you need a PhD to understand. It's a very simple concept. The fewer resources you provide, the greater the need, because of the greater degree of illness in society, because of growing insecurity among the young, increasing medical issues among the elderly because of a rapidly increasing elderly population, and issues that are directly related to climate change and the privatisation of many aspects of the healthcare system which should be in the public realm. So it doesn't matter how much you complain about inadequate services. The fact is that unless governments at the state and federal level are willing to tackle this issue, tackle the monetary aspect of healthcare, and ensure that those sections of society that for so long have been able to maximise their profits irrespective of the harm they do to the people of this country, we will continue to have ramping of ambulances outside accident emergency departments. We'll continue to have waiting lists that are growing longer and longer and longer. We'll continue to have people not being able to access healthcare because they don't actually have the monetary resources to buy the best healthcare money can buy. So ultimately, the ball's in your court. Ultimately, change will only occur when a majority of people demand that governments begin to act on their behalf. It's incredible that in this country we have governments at both the state and federal level who cannot satisfy the basic human needs of the people they represent, as far as food security, access to public education, access to public health, access to recreation, and the list goes on and on, while at the same time we are willing to give considerable tax breaks to both local and overseas owned corporations and businesses that they employ a few people in this country. Nothing highlights this more than the travesty of having our mineral resources developed by corporations which create billionaires and massive profits for shareholders at the expense of the very people, this country's First Nations people and the rest of us, who own these resources in the Commonwealth of Australia. Change will only occur when you are willing to take that next step. If you're not willing to take that next step, nothing will ever change.